Hello, everyone, and welcome to the third webinar in our 2019 webinar series titled Introducing the SOAR Child Curriculum. My name is Pam Hine, Senior Project Associate with the SOAR TA Center, and I will be your moderator today. Before we begin, just a few housekeeping items to review. A disclaimer. This training is supported by the Substance Abuse and Mental Health Services Administration and the U.S. Department of Health and Human Services. The contents of this presentation do not necessarily reflect the views or policies of SAMHSA or DHHS. The training should not be considered substitutes for individualized care and treatment decisions. A few webinar instructions. As a reminder, your lines will be muted throughout the entire webinar. This webinar is being recorded and will be available for download on the SOAR website in about a week. You may download now the presentation slides and other materials by going to the top left of your screen and clicking File, then Save, and then Document. Or you can visit the SOAR website at soarworks.prainc.com, click Webinars on the left sidebar, and choose today's topic. At the conclusion of the webinar, you will immediately see a brief evaluation, which we kindly ask you to complete. And finally, we will save all questions and comments until the end of the presentations, at which time we will review instructions for posing questions to panelists via the Q&A function. Just go over our learning objectives today. It is our intention that by the end of this webinar, you will have a better understanding of the goals and objectives related to the addition of the SOAR Online Course for Children. You'll also learn how SOAR providers can begin to integrate SOAR for Children into your SOAR initiative. And we will outline some recommendations for implementing SOAR for Children with your community plans to end family and youth homelessness. So to review the agenda briefly, to reach those objectives, we will begin this afternoon with presentations from Kristen Lutfer, the SAMHSA SOAR TA Center Project Director. You will then hear from Caroline Bolus, who is the Maryland SOAR Director. Next up, providing a SOAR local perspective from Austin, Texas, is Susie Brady, who's the local lead. And rounding out the presentations is Laura Kolb, staff attorney with the Homeless Advocacy Project in Philadelphia, who has experience in filing SSI applications for children. Each attended the recent SOAR Leadership Academy for Children, which was held in Washington, D.C., so we are thrilled to have them share their experiences and initial plans with us today. And finally, we will end with plenty of time for Q&A, which are facilitated by the SOAR TA Center staff. So providing today's welcome is Robert Grace, SOAR Project Officer with the Homeless Programs Branch at the Center for Mental Health Services in Rockville, Maryland. Bobby?
Thank you, Pam. On behalf of the Substance Abuse and Mental Health Services Administration and the Homeless Programs Branch, Center for Mental Health Services, I would like to welcome you to this SAMHSA SSI SSDI Outreach, Access, and Recovery, SOAR webinar called Introducing SOAR for Children. Many of you already know that SAMHSA SOAR helps states and communities increase access to Social Security disability benefits for eligible adults, and now children and youth who are experiencing or at risk of homelessness and have a serious mental illness, medical impairment, and or a co-occurring substance use disorder. Today's webinar will focus on the new and expanded edition of the SOAR Online Course Child Curriculum. This webinar will also help you learn more about how to take the first step towards integrating SOAR for Children into your SOAR program. I would like to especially thank our presenters for your willingness to share your expertise with us. Again, warm welcome, and thank you all for joining us today. Now, I'll turn things back over to Pam Hine, who will be moderating today's webinar. Thanks again, Pam.
Thank you, Bobby, for your generous welcome. I will now turn the mic over to Kristen, who will kick things off. Kristen, please begin your presentation.
All right, thanks, Pam, and hello, everyone. I am very excited to speak with you today about how SOAR can help end homelessness, build resiliency, and promote recovery for children and youth with disabilities who are experiencing or at risk of homelessness. I'm going to share with you a little bit about how the SOAR program expansion to include children, why it's important, and how it works. All right, so we have a lot of people joining us today who are currently involved with SOAR for adults. I also know that we are welcoming quite a number of you who are new to SOAR completely and are here to learn about how you can get involved with SOAR to serve your population of children and youth. So we'll start from the beginning. SOAR stands for SSI, SSDI, Outreach, Access, and Recovery. But it's not just about the applications. It's about what role the benefits can play in transforming lives. SOAR is a SAMHSA-sponsored program that focuses on increasing access to Social Security disability benefits for individuals, now including both adults and children, who are experiencing or at risk of homelessness and have a serious mental illness, medical condition, or co-occurring substance use disorder. SOAR for adults is currently active in all 50 states and the District of Columbia, but each state is at a different level of implementation, and SOAR for children is just beginning. There is no specific federal funding or grants for SOAR activity, and so the SAMHSA SOAR TA Center works with states and communities to develop plans for implementing the program through technical assistance and training. So how did we come to this expansion of SOAR? The SOAR training and process was originally developed for adult SSI and SSDI applications in 2005. We worked hard for nearly 10 years, rolling SOAR out to all 50 states in the District of Columbia. And we were fielding questions during that time about SSI for children, but we didn't yet have an answer or solution. In 2014, we issued the Child SSI issue brief, which was a wonderful introductory resource for SOAR providers who wanted to better understand SSI for children. But it was a temporary solution to the need for something more. So we began some formal discussions about SOAR for children with the SAMHSA Child, Adolescent, and Family branch in the spring of 2017. And those plans developed and were approved, and we launched the huge undertaking of developing the SOAR Online Course child curriculum with an expert panel in September of 2017. We brought together experts from child welfare, Medicaid, systems of care and children's behavioral health, from school systems, juvenile justice, youth and family organizations, and more. And these experts helped to shape the direction of our work, and many of them consulted on and helped draft key parts of the curriculum. After extensive reviews from SAMHSA and SSA, and the hard work of the SAMHSA SOAR TA Center team at Policy Research Associates, a very special shout out to my team, we launched the SOAR Online Course child curriculum on October 31st, 2018. So why SOAR for children? Why did we embrace this huge undertaking? Why was it so important to SAMHSA to expand SOAR? We know from data collected by the National Center for Homeless Education and the National Center on Family Homelessness that children and youth who are experiencing homelessness have higher rates of disability and experience higher rates of mental health problems, developmental delays, and poorer cognitive outcomes than their stably housed peers. We know from HUD's 2018 Annual Homeless Assessment Report to Congress that there were 56,342 families with children, representing 180,413 individual adults and children experiencing homelessness in 2018. There were 36,361 unaccompanied homeless youth under the age of 25 in 2018. And we also know that unaccompanied homeless youth are more likely to be unsheltered than all people experiencing homelessness. The time is now. So if we want to build a foundation for resiliency and recovery, then we need a strong brick of steady income. We also know that we need employment and education and health insurance to provide stabilizing bricks in that foundation. And income is just the beginning. So Social Security benefits and programs are complex, and there's a lot to learn. And so I'm going to give you just a taste so we're all on the same page and I leave you wanting a little bit more. And for those of you who are familiar with SSI and SSDI for adults, I want you to listen closely because there are special considerations and eligibility criteria for children. The Social Security Administration offers Supplemental Security Income, or SSI, for children. That's birth from up to age 18 attainment. And the benefit is for children who are disabled or blind. The non-medical financial need for SSI is a complete picture of the child's income, resources, and living arrangement, as well as their family resources. And like with adults, the maximum federal benefit rate is $771 per month in 2019 and comes with Medicaid in most states. It's very important to understand how SSA defines disability. The Social Security definition is going to be different than your doctor's definition, your insurance company's definition, and what's outlined in a child's IEP. SSA is looking for three primary components. Does the child have a medically determinable physical or mental impairment that has lasted or is expected to last 12 months or more or result in death? And does the child have significant functional impairments as they compare to children of the same age who do not have physical or mental impairments? So like with adults, this is not a short-term or partial disability program, and having a diagnosis is not enough. Having a chronic condition is not enough. That illness or condition must be impacting the child's functional abilities. The evaluation steps for children's disability is different than for an adult. Some of you are likely familiar with that 5-step sequential evaluation for adults, but for children there are only 3. And Social Security is still looking at whether the child is working and earning SGA. And so if they are a child of working age and earning $1,220 a month, substantial gainful activity, then they're not eligible for SSI. But if not, SSA will determine whether the child has a severe impairment. If yes, they will then determine if the child's impairment meets, medically equals, or functionally equals the listings. So this is the only step that a child can be approved for benefits. However, you'll notice that compared to adults, there's an additional opportunity to functionally equal the listings. And we go into great detail in the SOAR Online Course child curriculum about how SSA looks at the domains of functioning. And so I hope that you can see that even if you're an expert at adult SSI and SSDI, that you'll have a lot to learn about child SSI. The good news is that the SOAR process remains the same with the expansion to include children. We have learned so many great lessons over the last decade. We know what elements are essential to a successful SOAR program. We know SOAR providers need comprehensive training through the SOAR Online Course and SOAR Online Course review session trainings, staff who are dedicated and can maintain contact with the applicant and provide outreach services when necessary. We know successful providers are completing the SSA 1696 and serving as the applicant's appointed representative, collecting and submitting medical records to support the disability application, collaborating with physicians for assessments and medical information needed to support the application, submitting a medical summary report along with the application, and doing so with a quality review process that includes tracking outcomes to measure success. So this model is parallel for child and adult cases. There are definitely more players and stakeholders involved as we expand this work, and there are technical details to learn about new forms and eligibility criteria, but the strategies that we use to submit good quality applications that are approved quickly, that remains the same. So through community collaboration, partnerships with SSA and the disability determination services and medical providers, SOAR-trained case managers have been able to successfully assist over 39,213 people to get approved for benefits on their initial application. And for unassisted applications from people experiencing homelessness, the average approval rate on initial applications is only about 10 to 15%. And the national average for all applicants isn't much higher, only about 29%. So most people are denied on their initial application. However, the national SOAR approval rate is over double that at 65%. SOAR decisions are made in an average of 100 days, and there's no more waiting 1 to 2 years for an appeal. SOAR is all about getting it right the first time. Select providers in a few states have been implementing SOAR with children and tracking their decisions in OAT. So for 368 decisions, they saw a 72% approval rate and an average of 106 days to decision. So we know that SOAR works for children too. SOAR cannot and does not function in a vacuum, and we rely heavily on our community partners and are so glad to be welcoming new partners to the initiative. First and foremost, the Social Security Administration is an essential collaborator. As many of you know, SSA is the federal agency that's administering SSI and SSDI for adults and SSI for children. And because SSA is federal, their eligibility rules are the same in every state. And they're making that non-medical decision on the claim. However, it doesn't stop there. Every state has a Disability Determination Services, or DDS, that's working in partnership with SSA to make the medical or disability determination. We've got medical and treatment providers that are extremely important to gain access to assessments and evaluations and the corresponding medical records that support the claim. And we know it's really important to involve partners from criminal justice and juvenile justice organizations, from Veterans Affairs and active duty military family services, employment and education programs, schools, housing providers, peer, youth, and family-run organizations, and others that help to ensure that individuals who are served by SOAR are receiving the comprehensive services and supports, and that your SOAR program's not operating in a silo. So we've created an organizational chart of sorts that you can tell has a pretty flat structure. It includes the SAMHSA SOAR TA Center, all 51 state and district team leads, hundreds of local leads, and thousands of case managers. And we all have slightly different roles and expectations when it comes to providing training, answering questions, tracking outcomes, doing quality review, and assisting directly with applications. However, we are all ambassadors for the SOAR initiative and are united in ending homelessness for individuals with disabling conditions. So the SAMHSA SOAR TA Center provides support to states and communities both virtually and through on-site support. We have liaisons who are responsible for SOAR in multiple states and who build relationships locally to provide personalized service. We provide assistance from strategic planning at the state level and developing funding plans and key collaborations with federal partners to helping case managers with question number 25 on the SSI application. If it has something to do with Social Security disability applications, we want to help make the process smoother, more timely, and at a higher quality. We offer soaring over lunch calls for new and seasoned caseworkers to get their questions answered, and we celebrate success stories in our monthly newsletter. We train local and state leaders in our Leadership Academy and maintain a library packed full of tools and resources for use by stakeholders at all levels. I mentioned earlier that we released the SOAR Online Course for Children at the end of October last year. That means that we now offer 2 complete 20-hour courses in our catalog. Both courses are online, free, and available to take anytime and anywhere. We estimate that it takes about 20 hours to complete, including the practice case component, and that successful completion comes with 20 free CEUs from the National Association of Social Workers. In January, we just trained 29 leaders from across the country at our SOAR for Children Leadership Academy. And we anticipate that they will be offering training cohorts in their communities to help support participants through the course completion and include that in-person review session to connect with local trainees. Like the adult curriculum, the child curriculum includes 7 classes of articles, short quizzes, and a comprehensive practice case component. We've developed tools, worksheets, and other resources that are specific to working with children, youth, parents, and caregivers on child SSI claims. The child curriculum offers 2 fictionalized practice case studies, one for a 12-year-old boy who lives with his mother and sister in a shelter, and one for a 16-year-old girl who has been living in foster homes and group homes. We've developed medical records from specialists, behavioral health providers, and provided sample IEPs. And we give the learner a realistic scenario to practice completing the required SSA forms and a complete medical summary report for each fictional child applicant. So many people ask us what it takes to get involved with SOAR. And like I mentioned, the training takes approximately 20 hours. And then we estimate that based on both anecdotal evidence and information that's reported in our outcome tracking system, that it can take 20 to 40 hours to complete each application. So having dedicated staff time to learning and then implementing the model is a really important consideration that requires planning and supervisor commitment. We have a resource on the SOAR website that outlines the importance of implementing the fidelity model and tracking those outcomes. It's really worth the time investment. The benefit to the individuals you serve is first and foremost, but it also brings Medicaid reimbursement, funding opportunities, and mission fulfillment to your agencies. So for those of you who are already involved with SOAR for Adults, identify children and youth counterparts with your existing stakeholders. Ask them for their contacts in each specialty area, and organize a SOAR for Children orientation with your local and state SOAR leaders. If you are part of your SOAR leadership team, schedule a separate meeting with SSA and DDS to discuss the SOAR process for child SSI claims. Definitely talk to your SOAR state team lead or SAMHSA SOAR TA Center liaison first to see if those discussions have already started. And we definitely recommend that you include youth and parents on your steering committees. These are essential voices that you need for success. You can find your local contacts for SAMHSA Systems of Care, for family-run organizations, and for Youth Move chapters at the following links. I think I went past it too fast. Here we go. Oh. Yeah, well, maybe the slide is missing, but we'll get that slide added for you. We don't want to see your siloed SOAR programs. So we encourage SOAR programs to integrate child and youth providers in existing efforts. We want you to hold inclusive meetings that represent adult and child SOAR stakeholders. And you can also form work groups or subcommittees that focus on special issues that arise. There may be a subcommittee that focuses on unaccompanied youth, or a work group that strives to build relationships with the local school system for education records and teacher collaboration. So I'm going to talk very briefly about tracking outcomes because it is absolutely essential to the successful implementation and expansion of this program. And I just can't talk about SOAR without talking about OAT. So we provide a free web-based database to track SOAR outcomes. It is very user-friendly, it's on a secure server, and is HIPAA compliant. Registration is easy. There are multiple user roles to help with agency, local, and state leads in order to facilitate an ease of reporting and review. And did I mention that it's free? So here is a screenshot of our snazzy dashboard that gives some nice monthly snapshots in comparison to state and national numbers. And we track some basic outcomes information and some additional optional information to keep the data entry burden low, only a couple minutes per application, but to still provide rich data and reporting. And child SSI cases can be tracked and reported through OAT. So we want to encourage you to gather more information about SOAR and consider incorporating SOAR for Children into your services. If you visit the SOAR website and go to SOAR in your state, you can find your state team lead and your SAMHSA SOAR TA Center liaison. And you can check out our website and the new child curriculum. And please reach out to us at the SAMHSA SOAR TA Center for other questions you may have, or if you'd like to make a plan for using SOAR. And finally, we have some additional resources here, links here for you for future reference. That concludes my presentation, and I'd like to turn it over to my esteemed colleague, Caroline Bolus, to talk to you about implementing SOAR in Maryland.
Thank you so much, Kristen, and thank you too for giving me the chance to speak today. Very happy to be here. So just like to start off by talking a bit about the SOAR program in Maryland. Since we started tracking data in 2009, we have submitted over 1,600 claims. We have an ongoing approval rate of 86% for initial claims and 77% for appeals. And one of the things we've really tried to do is to focus on supporting high-quality claims. We've done this in a number of ways. In addition to having the online training, we also have a one-day in-person training that focuses specifically on some of the Maryland processes, and our DDS liaison comes and talks about their work as well. We also introduced some years ago a SOAR certification process, which is over and above being SOAR trained. And so individuals have to do a certain number of SOAR cases and have a certain number approved. They submit their MSRs and their data forms and a self-assessment form, and then a review committee looks and provides feedback. And not only has this helped with the quality, it's also really helped with recognition, because again, it's really showing that we value the work of our case managers. We are very fortunate to have excellent relationships with DDS, and we have a group of 10 examiners who deal with all our SOAR claims, and they're a great resource in terms of helping us when things are going well, but also giving us information if we need to change how we're doing our claims. We have a structure of local leads and work groups I'll talk about at a later slide, but we also have a statewide planning group made up of representatives from DDS, from SSA, community providers, DOORS, and a whole host of other very committed individuals. And then lastly, for the last 5 years, we have held an annual SOAR conference. This basically is a chance to bring our SOAR community together, to hear presentations, to learn from one another, and also we have SOAR Value in Action Awards that really allow us to recognize the work of our partners, our community, and how they really all work together to bring SOAR. And we do this all work through a combination of some funded and mostly non-funded SOAR-trained case managers who are absolutely instrumental in making our program grow. So I was fortunate enough to attend the first Children's Leadership Academy in January, and afterwards I took some time to reflect on that experience. And at first one, in terms of feelings, it was like, wow, this is exciting, but it also felt daunting. There's a whole new set of languages and new forms. And then I thought, well, we were here once before with adult SOAR. Let's embrace the excitement and know that we are going to have a lot of support along the way. The other key thing, though, I think it really allowed me to think about, by thinking about children and SOAR, it helps reflect on our adult program and how are we doing things. Can we be doing things differently? Having new people in the room, having new ideas, I think will also enhance what we've been doing as well. A surprise to me was I had said before I went on the course before I did the course and went to the academy that I didn't think we'd have to do the full children's course. Hey, how different can it be? Maybe we would just do like a short couple of hours. And then having done the online course and been to the academy, I'm now really clear that yes, there are similarities, but the differences are enough to really say doing the full online course is essential. So even if someone has been trained in SOAR doing it for years, I think going through the online curriculum is so important. And then lastly, picking up on what Kristen said, I think SOAR is such a learning community, just really knowing that there's going to be a lot of support, not only from the TA Center, but also from the other states. People are very willing to share their information. And so that adds to that excitement that we're not doing this alone. So again, thinking about the children program gave us time to think about, okay, so what can we take from what we've done with the adult program? What worked, what perhaps didn't work? And starting with perhaps what didn't work on reflection is, I I think like a lot of states, we sort of rushed to want to train people and perhaps didn't do enough preparation work. And so you have the situation where somebody might try and do a claim and they ask somebody to sign this strange thing called a medical summary report and they're told, I don't know what you mean, or why do you need medical records, or what is this thing called SOAR? And with that, also training individuals who perhaps were never going to do an application. So rather than perhaps saying you need a leaflet or you need a 2-hour presentation, putting people through a 2-day training as it was then for something that really they were not going to actually use practically. So they were things that we really sort of want to make sure we avoid moving forward. But lots of things have worked well that we also want to embrace. So one of the things that we found really helpful was actually concentrating on growing SOAR area by area. So rather than having a scattergun approach, actually saying, okay, let's come into this community and really work on establishing it and then use those lessons learned to move on to the next community. And they can also be mentors as well. Key to that has been our local leads, who really are the driving force for SOAR in Maryland. They have that in-depth knowledge of their community. They know who needs to be at the table, and they know who are the person that has to have this information. So their knowledge and commitment has really, really been important. They know the medical providers, etc. And so, again, having that structure really helped us get an understanding, because obviously there may be differences in a rural community versus an urban one. I agree with Kristen again about data, really right from the start, collecting that data, sharing that data, celebrating those successes. We still do the SOAR happy dance when we get those approvals, and really helping people see that what they're doing matters. And conversely, it won't all go smoothly. It never all goes smoothly. We're working with the most complex cases, and so there will be challenges. So again, trying to have a problem-solving approach rather than just complaining or being negative. What can we do to overcome those? And trying to act quickly rather than let things fester. And then one thing that really, I think, really helped was, again, even before we trained anybody, before we do the first application in a community, really reaching out to those providers, explaining SOAR, explaining what the medical summary report is and why we'd like them to sign it. This is why we need those medical records. And I think doing it at the beginning is so much better than waiting to the case at DDS and then panicking because you need it now. This way we could really work on the timescales of the providers, go and meet with them when they were ready for us, and explain how they could help us. And so that really worked well. So that moves us on to thinking about how we're going to move forward with children and SOAR. For me personally, a big thing has been and continues to be is research. Before this, I have really had very little contact with the world of children. My experience has always been adult mental health work, and so this is exciting, but it's like a whole new language, a whole new system to really get my head round. I've been very fortunate to have actually met with Denise Solzbach and her team at the Institute for Innovation and Implementation, and that was so helpful. And yet I also know there's a lot more to learn as well. So really looking at who are the key stakeholders. Some will be the same. Some will already know about SOAR. Others, this might be really new. So trying to work out who do we need to be talking to, both to learn and also to share, to bring those two worlds together. Thinking about what their role will be. Again, not everybody needs to know everything, but who will be doing the applications, who will be sharing this part of the process, so having those conversations. And then really being able to articulate the need and value proposition for SOAR. So using like the statistics that Kristen shared with us. Again, for the adult SOAR, we have a lot of information, and really being able to articulate the need in a clear way is going to be really important when we sort of pitch to providers. And then we intend to do the same as we did with adult SOAR and really start with one community, see what works, have lessons learned, and then build from there. So either one or two pilot sites. And thinking about those pilot sites, again, who's going to be that local lead and how they're going to work with our adult local lead, but really wanting to have the expertise of somebody who is really enmeshed in the children's community. We plan for them and us to then coordinate a local stakeholder meeting, see who we need to invite, get them to the table. That will be a way to share information, to hear concerns, to hear what people think will work, and from that, create a work plan that will look at things like who is going to do the applications, who is going to need to know about SOAR, who might be the medical provider, how can we talk with them about the process. So have that all planned before we actually start training case managers or whoever's going to be doing the applications. And really using that local knowledge. Although the SOAR components remain the same, we do know that there's local differences. And so we find having the people at the table really come up with the process allows us to really use their knowledge and get a plan that's going to work. One thing we have found too is sometimes someone will come and they're really excited, but when they go back to their agency, the decision makers are, we don't think this is a good idea. So again, the importance of really trying to reach the directors and explaining so we get that buy-in, so they can give us the resources that we need to make this happen. And then lastly, really being clear that this is a pilot. There are going to be challenges. Some things aren't going to work, but we're learning together. And so having that sort of can-do positive attitude, I think will make a huge difference. So we see ourselves as sort of SOAR pioneers and really doing something very exciting and really being able to, at the end of the day, really make a difference in people's lives, which we definitely want. Sorry, we didn't do the slide, but that is for me.
Thank you so much, Caroline, for sharing your insights, your initial thoughts on moving forward with integrating SOAR with your adult initiative, and also sharing how important it is to highlight the differences between the adult and child curriculum. We are getting some questions early on that ask that question. If I'm a seasoned SOAR caseworker for adults, should I enroll in the online course for children? And I really appreciate that you've answered that question throughout your presentation, that there are enough differences that you should enroll and complete in the online course. So we thank you so much for that and your very positive outlook on bringing SOAR into Maryland. So with that, we're going to continue with hearing a local perspective from Susie Brady, who is the SOAR local lead in Austin, Texas. Susie?
Hello, everyone. I work for Integral Care in Austin, which is the local mental health authority for both Austin and Travis County. And we provide support for adults and children living with mental illness, substance use disorder, or intellectual and developmental disabilities throughout our community. Our services include crisis intervention, ongoing counseling and treatment, and connection to resources in order to assist with recovery. We currently have 2 local leads for our area, which is much needed for the rate at which SOAR is growing here. I co-lead with the COC SOAR Systems Coordinator, Nikki Kozak. So FYI, when you hear me saying we in the remainder of my portion of the webinar, that's going to be referring to both me and Nikki because we are leading this together. And within my agency, Integral Care, we have 14 SOAR-trained employees across 10 different clinics and programs. I lead a team of 3 full-time dedicated SOAR specialists, 1 within our supported housing programs, 1 that works with all of our different ACT teams, and 1 that is based out of one of our integrated clinics. As team lead, I directly supervise the dedicated specialists and provide group supervision and oversight to all SOAR providers throughout our agency. I'm going to mirror what everyone has said so far, but completing the SOAR Child curriculum and then attending the first ever Child SOAR Leadership Academy provided me with an unbelievable amount of knowledge and energy to start a Child SOAR initiative here. And the first thing I want to reiterate, and then I definitely get asked a lot, is yes, you do need to take the children's online course. The information is different, and it is really imperative even for adult experts. So you learn the importance of accurately describing a child's functional impairments, as Social Security will use this information that you provide to determine how the child's functional abilities compare to the functional abilities of a child the same age who does not have physical or mental impairments. For child claims, the impairment can meet, medically equal, or functionally equal the listing, and there are 6 domains of functioning that can be used to determine if the child functionally equals the severity level of a listing. The course goes into great detail on these domains and offers a ton of information to help with this portion of the disability determination process. Those of you that have taken the adult course know that it's really the best online course I've ever taken, and the Child SOAR curriculum is just as good. It's awesome. You do use some of the same forms as you do for adult claims, but you're not necessarily filling them out the same way. Also, there are additional forms to learn about and practice on. What I really liked about the child course was having the examples that you can look through. They have an applicant's IEP records and a teacher questionnaire. The teacher questionnaire is a special Social Security form that teachers fill out for children that are applying for disability. You get examples of these that you can look through, just become more familiar with, and then use for writing your MSR and filling out all the forms. And that is so crucial with the SOAR online course, because you're not just taking all of the information in, you're also given a chance to use it. That's one of the things that, one of the biggest hurdles after you complete the online course is actually starting and completing your first claim with a real person. But the fact that you've already done all of those documents with your fake person really helps out a lot, and you feel much more confident in your abilities. Leadership Academy. It's an incredible experience for anyone that is interested in becoming a SOAR leader in your community. It's truly awesome to be a part of such an amazing group of people that are doing such great work just throughout the nation. This particular Child SOAR Leadership Academy came at just the right time for me, personally, professionally. The energy from our instructors, who were awesome, and the participants just really served to rejuvenate my spirit and my belief in what we do. And that those of us here, we know how important that is. There is really no greater motivator for getting SOAR started in a community than a SOAR Leadership Academy experience. And you also get a lot of assistance and information about options for both funding and sustainability of your SOAR programs, and that's something that we all need. Importance of community. One thing that we have worked hard at forming in our area is a vibrant and supportive SOAR community, even going as far as having SOAR support groups every month. We want to integrate our child SOAR providers into this network and maintain the same support and sense of community for everyone utilizing the SOAR process in our area. It really is so important to have that connection and sense of community as a SOAR provider. If your area doesn't have that yet, then create it. Reach out to your state lead and find out about ways you can connect to other SOAR providers in your state. Always remember that the TA Center provides many opportunities to connect with others using the SOAR process nationwide as well. I love the SOARing over lunch calls. Those are great. And it just helps to remember that you aren't alone, and it's just very important to remember that. The culmination of the Leadership Academy is coming up with your action plan steps that you will be taking upon your return home. My plan is to start with implementing Child SOAR within my own agency with my very first claim. Our Families with Voices program provides housing services to the parents of children receiving mental health services who have been identified by a local school district as being at risk of homelessness. So these case managers are now aware of the Child SOAR process and have already sent some referrals for me to look into. So I'm hoping that someday I may be able to train someone that's on their team to be the SOAR specialist on that team as well and go from there. But right now I am working on doing my own. Nikki and I are putting together a survey monkey to send out on our homeless services electronic mailing list to just gauge interest about utilizing Child SOAR within the community. We've already made sure our adult SOAR providers know about the child curriculum, and there are some that have expressed interest in taking the child course as well. I've also talked to our COC and my co-lead about incorporating questions that assess child disability and income sources that include Child SSI into our coordinated assessment process. So that is exciting. A big part of our job over the next couple months will definitely be research. We will be looking into child and family serving entities to assess for interest, training needs they would have, and possible referrals. We also need to examine which of the existing agencies that do adult SOAR claims are also serving children and families. We want to be able to build upon the relations that we already have, along with creating new ones. And we do have some ideas already for some pilot programs that we think would work out well. I'm also planning on reaching out to our state coordinators for McKinney-Vento to explore collaborations and contacts I can connect with in the school districts. I think the SOAR website has links that go to each of the state coordinators for McKinney-Vento. One thing that is really great about living in a state capital of the big state is that you have easier access to a lot of the state coordinators of things. So lucky for me, they are just down the road. So I am going to be meeting with them soon. I also want to explore the possibility of working with some of the school-based therapists within my own agency. Integral Care has licensed therapists based in schools that provide on-site mental health support to students experiencing mental health issues and struggling with substance use. So I'm hoping this may be a good connection to make for the further implementation of Child SOAR within my agency. So when discussing how we would introduce the Child SOAR process in our community, we started with Austin's action plan to end homelessness. Families with children represent approximately 11% of our homeless population in Austin. We are going to advocate that Child SOAR can be a key part in helping to end family homelessness in our community. It would allow for families to have more resources to be able to adequately care for their child or children and not be in a position of having to choose between health care for that child, other basic needs, and rent. SOAR is specifically mentioned in the action plan as part of our solution. Expanding this to children would only enhance what we are already doing, and looking for ways to train agencies who specifically target this population will significantly pay off. Austin is also one of 10 communities selected by HUD nationwide to be part of the Youth Homelessness Demonstration Program. Since this program is for youth ages 18 to 24, we're currently looking at any of the youth that have children that could possibly qualify for SSI. And we are hoping that in the next year, a child-specific local lead for Austin will emerge. I expect things to start growing and changing fast once our Child SOAR initiative gets going here in our community. And I'm definitely going to keep my eye out for someone that would be able to take the Child SOAR reins and work with me and Nikki to keep SOAR strong in Austin. That is it for me.
Thank you so much, Susie.
You're welcome.
You've done so much since January, when we have the Leadership Academy, and reaching out to potential child-serving agencies and planting those seeds to grow SOAR for children in the Austin area. So thank you so much. You've done so much. Now we're going to turn it over to Laura Cole, staff attorney with HAP, the Homeless Advocacy Project in Philadelphia, who's going to share her experience from a provider's perspective, and also 2 success stories that I think you will all really enjoy seeing how SSI can be really transformative to the kids and also their families. Laura?
Hi, everybody. Thanks so much for having me. I'm really happy to be here and to have a chance to talk to y'all. So what I'd like to do with my time is I'll give you a brief background about HAP, or the Homeless Advocacy Project, for those of you who might not be familiar with our organization, and then an overview of some of the work we've been doing with SOAR and looking ahead to, what we hope to expand to include children's SOAR and the Children's Leadership Academy and what that was like, and then talk about, highlight a couple recent cases that we handled here at HAP for kids who were had SSI claims. And then I think hopefully I tried to choose 2 examples that will let us think a bit about how those experiences and representing those kids can inform our expanded work with kids going forward. So HAP provides free civil legal services here in Philadelphia for individuals and families who are experiencing homelessness. But we do a wide range of issues we handle, but we do a lot of disability work. And since 2009, we started handling SOAR claims. And since then, we've filed 2,880 claims. We've got a 91% approval rate. And right now, our average processing time is 58 days from application to decision. And so we're a little different than some of the other people that you've heard from because we're an in-house model, meaning that we have a small staff here, but we've got 7 attorneys, I think, right now that file claims and 2 paralegals. And then we are supplemented with, we do have some SOAR-trained people that help us. They're not case managers, though. They're really, at this point, mostly attorneys that work with us that are on a pro bono basis that have all been SOAR trained. So I'm not sure how many of them there are, but we have like a core of them that we're always training and keeping in the loop. Oh, I'm so sorry. I knew I was going to forget to do that. Look. Now you can see what I just said. All right. So currently, we do provide SOAR services for a lot of different populations. We started with, adults in shelter, adults with serious mental illness through GBH. The project that I oversee is the DHS SOAR project, and that was developed to provide SOAR services for youth that are aging out of care. Out of like the child welfare and juvenile justice systems. And then we also, this past year, expanded DHS SOAR to include DHS families, so families that have open cases who are working on reunifying with kids whom they've lost custody of. And a lot of times, housing and income are one of the huge barriers to them regaining custody. So if they're eligible for SSI, that can be a source of income they need to get back on track and get their family back together. And then we have a justice project working with some of the specialized courts here in Philadelphia, the diversionary alternative sentencing courts. We have Veteran SOAR, and we have a CABI grant. So we kind of have a whole range of offerings that way. And what it seems like a natural progression, to move on to offering SOAR for kids, and we're really, really excited about that. It's something that I've been asked about for years, and so we are in the preliminary stages. We are discussing it with our partners. The responses have been really favorable so far. Everybody's seeing it as an exciting opportunity and a much-needed resource, for the children and families that we're already working with. So we're excited to get started. We haven't, we're hoping to have a pilot project and we have a goal set, but we don't have anything, kind of finalized at this point. So again, it's preliminary, but we're all pretty hopeful and excited about it. And I just wanted to echo really briefly Caroline and Susie's thoughts about the Children's Leadership Academy, because it was really an amazing experience. I felt like I learned so much, and I really, really enjoyed hearing from people from all around the country and, just getting an idea of all the things that are happening. And it was kind of I felt rejuvenated also and more, inspired it's nice to step back and kind of see the bigger picture, because I think so often we're, or at least me, I'm like in my office doing whatever I'm doing and not really stepping back and looking at, kind of what's happening and keeping in mind those larger goals. So it was really, really edifying that way. And again, to echo everybody, the curriculum, the online curriculum was amazing. The materials I thought were really thorough and, helpful. I would think, even as someone who's filed a certain number of claims, both kids and adults, applications and at the appeals level, have represented people, children's claims are different. And I really found that, I really believe that the SOAR children's curriculum is going to be essential to filing successful claims. And so I would encourage everyone to do it. I think it is necessary. And it is longer, than I was expecting. But, again, it's just very well done. And you can tell that these guys spent a lot of time on it, and it really came together beautifully. So, but there's some special challenges with kids that I think that course is really going to help anyone who's moving on to provide SOAR for kids. Okay, so that's that. So now we're going to just tell a couple stories and try to choose stories that were a little different in their circumstances. So I'm going to start with Janey. This was a case that was at the application level. So she was 3 years old, diagnosed with autism and ADHD, and she was having some really severe emotional and behavioral issues. Her parents, it was an intact family. Her parents came to one of my legal clinics out in the community because they were looking for help, because they really were kind of, not knowing what to do. They had moved to Philadelphia from Puerto Rico because as Janey was getting older, they couldn't get the services that they needed for her. She was kicked out of her preschool. I think they lost the apartment they were living in because she was kind of destructive and, hard to manage in the home. So they came to Philadelphia, and pretty quickly the same thing started happening. They stayed with family, but then a short time later they were asked to leave that house because she had become aggressive towards some of the other kids. So by the time I met them, the intact family was intact no longer. The mom was living in a small, really rented room, in kind of not the best part of town with Janey. The dad was in a homeless shelter. He was working part-time and helping, trying to pay for that room. There were no family beds available, so they were forced to separate. And the mom was having a lot of trouble getting anything done because Janey was really struggling. So she did, access the services that she needed. So that was one thing. But by the time I met them, they were overwhelmed by the paperwork, not sure where they were in the process, didn't know what to do next. So I kind of, approached it as I would of a SOAR claim, actually. We made sure that we got all updated evaluations if she didn't have them already. We got input from her teachers and from, other providers and from the parents, doing some parent questionnaires and teacher questionnaires. We also, I was able to, once we figured out who the adjudicator was in the case, had regular contact with her so that I could get an idea of what she needed to make that case, and to let her know, to just keep up with everything, because the mother was really at that point overwhelmed and kind of lost. So when it was an opportunity, anytime you can talk to the adjudicator as an opportunity to advocate. So we kept that communication going. And the outcome in that case was that within 53 days, we got a favorable decision. And so a short time later, Mom and Dad were able to secure a small apartment somewhere. So they got to, move in back together. And their, the family stability was increased dramatically at that point. So they're out of shelter, they're back together. And Janey continued to get those services that she needed. And hopefully, things could kind of calm down after that. So that was a pretty good outcome. It might have been even faster, I was thinking, if we had had like dedicated SOAR workers, if we had been involved, way early. But in all, that was pretty good. Now, Julian was kind of a different kind of story. Julian's case, the claim was at a completely different stage. So this was a claim that came to HAP when it was already at the hearing level. So his mother had already applied and been denied, and then they came to a HAP legal clinic where one of our volunteer regular pro bono attorneys agreed to represent them at a hearing. But this is an example of how, like a traditional SSI application, could move through the claims process, assuming, that a lot of them, as Kristen said earlier, are denied. So, and, people are forced to file appeals. So it kind of shows how stressful and onerous and lengthy the process can be. And just, and it illustrates how SOAR could really benefit everyone. This is still a success, I promise. I'm making it sound like it was a disaster. In one sense, I think you'll see why it kind of was, but in the end, it worked out. The problem is that it just took a really long time. So Julian was born in January of 2015, and by May, he was diagnosed he had a birth defect. Something with his bones and his skull prematurely fused or closed so that his brain could not fully grow and develop, which caused obviously, cognitive issues, developmental delays, not to mention that he had to keep having surgeries to kind of open it up so that his brain could grow. So he has that, and so by about a year after that, his mother does notice that he's really starting to fall behind. He had a twin, so she sees that he's really not progressing as his identical twin is. And so it's May of 2016. She files, an initial SSI application. He's about 16 months old, I think, then. So they wait around for about 9 months, and they get denied. No surprise, I guess, but then she appeals. So by the time the HAP attorney meets the family, they're in shelter. It's a mom, Julian, his twin, and a younger sibling. And they are, I guess Julian at that point is about 2. So they wait, the attorney's secured, and they start working on the case. Now they wait another 18 months to get to the hearing. So by now, Julian's 3.5, and it's September of last year, of 2018. And so they have a hearing, and yay, they win. They get a fully favorable decision. The onset date that the adjudicator comes up with is the date of the initial application, way back to May of 2016. So it's wow, that's great. Back benefits. We estimate it'll be about $21,000. So it seems like great outcome, right? But really not, except, the mother and the children were in shelter at that point for about 2 years, which is, causing lots of family disruption, obviously, not to mention, emotional stress, financial stressors. The mother, has those 3 small kids and 1 room in a family shelter. And Julian does have some significant medical and behavioral issues. And during that time, he had about 5 surgeries. So it's not ideal at all. And they were in shelter all that time when they might have moved on much sooner. So we kind of looked at that and we thought, this is great. This is a lot of money. This is a game changer. But like, what went wrong earlier? So it's hard to say. It might be that, maybe the documentation there was not all submitted, because we know it existed because the adjudicator found, there was evidence to support a finding that the child had been disabled at that point when he was like 1.5. So it wasn't that he didn't have treatment or documentation to support that. I think it might have been the records on their face, did not paint the picture of the child, and they didn't give us a sense of the whole child. And she didn't see, the initial reviewer just did not see the severity of Julian's condition. So as the SOAR process, could have done and would have done at the application stage. So I think the takeaways from that are that, there's clear benefits for our clients, and for Social Security and for DDS through SOAR for Children. For families, it's going to be a SOAR-trained person who can provide support through the whole process, can advocate for them, and can provide information. I get calls, I'm not kidding, every day from just random people in the community saying, I think I went to Social Security. I think maybe I have an application, maybe I don't. People have no idea a lot of times of what's going on, which is a problem, but they'll have a person to help them through all that. It'll be an expedited processing times and more favorable outcomes, which we've seen, with adult SOAR. And for Social Security and for DDS, I also see, they'll have more complete claims, better documentation up front. They'll have access to the claimants when they need them. That's one thing that I hear from my contacts now, like, oh, we want you to do Kids SOAR because it's really hard to connect with people, with parents. We can't find what we need. Everything takes so long. It'll be much easier and faster processing for them, for the adjudicators. And then, a decreased number of hearings. So fewer people will have to go through the stress of a hearing. There won't be as big of a backlog. Wait times will be decreased for those people who really, need to have a hearing. So it seems like a win-win on all sides, advantages for everyone. Because then in the end, we know establishing that income source is ultimately going to lead to, increased stabilization and recovery for that family. So those are two recent stories, and I think that's all I have.
Thanks, Laura. And again, thanks for sharing, ending our presentations with two success stories on how SSI benefits can, again, not only reunify, but also to stable housing and add to that resiliency that we talk about. So then thank you for that. And we know that we are now ready for questions, Q&A. So in order to ask your questions, type your question into the Q&A box that you'll see on the right-hand side of your screen, and we will answer some of those questions. And understand that this webinar today is to provide an introduction to our the new edition of the SOAR Online Curriculum for Children. And our plans for in the future will be to hold other webinars that will get more into the nuts and bolts of completing quality, successful applications for children SSI applicants. But again, please feel free to type in your questions. We have had a few that have come in already. So I think this one I'll pose to Kristen, and then others can chime in too. This is from a local lead, Christopher, who says, I'm about to conduct a cohort for the adult course where most of the caseworkers are children and youth caseworkers. Should I introduce the child course, or how would I approach that? Kristen, do you want to take a shot at that question?
Sure, absolutely. Thanks, Pam, and thanks, Chris, for the question. So I would say absolutely yes. So if these caseworkers are going to be working with individuals who are under the age of 18, that they absolutely should take the SOAR Online Course Child Curriculum so they can learn how to assist with an SSI application for a child and understand, the eligibility criteria for children. So it'd be really valuable for them to take the child curriculum. And I know you are a SOAR local lead, so you can access that SOAR Leaders only section of the website, and we have course cohort materials on there that you could use to help support those trainees through the course. And if you reach out to Abby, your SOAR TA Center liaison, she can also help, answer your questions as you kind of help them through the course.
Great. Thank you. And we do have questions that have come from other local leads who were, again, unable to attend the Leadership Academy. So Kristen mentioned where you as local leads can access all of the information about doing a SOAR orientation, doing an online course cohort training, and an online course review. So again, we have documents that are applicable to both adult and child, and have updated some forms and documents just for children. So those are great questions. So you can access everything that the folks at the Leadership Academy for Children received in that spot. So we have Pam, sorry to interrupt. Since we're on the topic of resources, I wanted to pull up just a couple of resources that we have on our website to make sure people are aware of them and can use them. So Susie, if you can help me with the technical part of that. We have a SOAR Online Course child curriculum marketing flyer, which you can use to promote the curriculum with stakeholders in your community. It just has an overview, some basic information, and the link to our online course catalog. So that's something that you can share far and wide. And so you can download this both from within WebEx, or if it's easier, you can get it straight from the SOAR website. When Pam explained where to find all of the webinar materials from today's webinar, we've got the links to these documents there as well. And it's Susie put it in the chat box, so you can just follow that link in the chat box to download it. And then the next resource I wanted to point out is just an overview of our child and youth resources that the SAMHSA SOAR TA Center has, and it just has a bunch of helpful links on it. So links to the child curriculum, some of our issue briefs, past webinars on SOAR with transition age youth, and some fact sheets, and some other kind of helpful information. So that's kind of a summary document of the resources we have available for children and youth. And then there was one final resource. I somehow missed the slide in my presentation, and I wanted to make sure you all had handy these links to access your local contacts for the systems of care, for family-run organizations, and Youth Move National. So they all have kind of local contacts on their websites where you can get in touch. So if you're looking for your local counterparts, you can find them, and that will get posted momentarily. And so while we work on getting those links up and visible, Pam, we could move to the next question. Thanks for bearing with me through those resources. Okay, great, Kristen. Very helpful that folks have access already to some resources to get you started and to figure out who are your child serving agencies in your area that you want to reach out. We had a question about, I know my school district has a homeless coordinator. Is that a person that I should contact about SOAR? Who would like to take that question, the homeless coordinator in their school district?
Hi, this is Laura. I'm not sure if I understand the question. Is the question that the homeless liaison would be a person who would file claims, or who would just need to be aware that the service was available, or what?
Yeah, it sounds like, to be aware of the services, possibly for referrals.
I think so.
I think so. I mean,
yeah.
Oh, go ahead.
No, you go ahead. Sorry.
Okay. I was just going to say.
We were going to check with. Yeah.
Yeah, I think the homeless liaison, I mean, that's a wonderful resource and a person that I think the more they know, and the more familiar they are with what's out there, I mean, the better for everyone. And they're on the front lines, and they're going to, come across youth that we might have trouble identifying. So I definitely think the more information they have about all services is really helpful. And even if they just know who to contact, even if they have questions and want to run something by whoever that person would be. But yeah, I would definitely get them in the loop.
Susie, did you want to add on to Laura's?
No, just that that's an excellent place to start. I think that is one area that we're moving into, and just so they are aware of what we may be doing and helping in whatever way they can. Yeah.
Great. Yeah, and one of the resources we have at the SOAR TA Center is what we call a matrix, which is available to local leads that does have as a category homeless coordinators to reach out to. So I think that would be a great start to introduce SOAR to the folks in that position. We have a comment actually from one of our state leads in Pennsylvania, just to comment on something that she's done consistently. Michelle writes, I've been promoting SOAR as a do it right the first time methodology to dispel the shortcut image. So thanks, Michelle, for that, because again, we do reiterate and we do like to share that spending time on the front end often pays off in the long run with a successful application. Quality application. So thanks for that, Michelle, for sharing that as well. We have a question about, let's see, this is a good one. And this would be for Caroline, I do believe. It's about, and it's something that you are, I think, thinking of in implementing SOAR because Caroline, being in Maryland, has a state certification process. Have you given much thought to an expectation for individuals who who are adult trained and have a requirement to submit a certain amount of cases? Have you thought about that for children certification? Have you thought anything about that, about the amount of cases that you may have as an expectation, or is this too preliminary to discuss right now?
We've definitely thought about it, and really we would see it being the same process. One thing we really want to do is try and use the lessons learned and the expertise that's been developed, and wherever possible mirror the two, so that, like we said, they're not these two separate things. And so for our certification process, people have had to have done 5 SOAR claims, at least 4 of which have to have been approved. And so absolutely, I would see it being the same for those doing children's cases. And one thing I haven't thought through, but I can't see why, if somebody was trained in both, if they were working perhaps with that transitional age youth population, so some might be technically children and some adults, why they couldn't mix and match, because again, we're really looking at the quality of the applications and particularly the MSR. So we may be able to have 3 of one, 2 in the other, but that's something that I haven't yet thought through fully. But definitely would see it having the same process and the same information provided. Okay.
Well, thanks for that. We have a question that came in about interviewing, and I think this could be something for Laura to take a shot at. How much interaction is typical interviewing children? Do you want to talk about that, your experience? Because I think that could be one of the differences where we're used to interviewing the adult for the adult application. Are you interviewing the children? Are you interviewing the parent or caregiver, or both?
Probably both, and maybe not so much interviewing as, it a lot depends on the age, because you figure from birth to 18 is a wide range. Now, most of the children's cases that I've had, especially recently, have been on the younger side, so they've been between 3 and 5 years old. So a lot of times the mother or the parent would bring them in, and so I'd have a chance to interact with them because they're kind of playing. We have some toys and things, and there's a chance to observe and to kind of interact a little. There's not always a lot that they're able to tell me, when they're 3 about what's going on. It's more kind of like what you could observe. The parents and the teachers and the other caregivers are able to provide kind of more detailed anecdotal daily things that they face with the child. So I guess it would be a little bit of both. But then I've had youth that I met like on their 18th birthday. This is before we were even thinking about children's SOAR. So I'd wait, they would contact me and they're 17 and then they're 18. So that's a different kind of interaction because, they're obviously, able, depending on how much insight they have, able to share things about their history or about what they're struggling with and kind of, what's going on with them more than maybe a toddler would. So I don't know if this is a good answer, but I would say the more time you can spend talking to people who know the child, no matter what their age is, well, and then the more that you can see and just even observe and interact, to the best of their ability, the better. Just because then you can paint the picture, right? I hope that helps. I don't know.
I think that's really helpful. And to plug the online course, we do have articles on engagement and interviewing, and again, paying attention to the developmental age of the child, and again, certain engagement strategies. You had mentioned having toys if you're going to be mostly talking to the parent or caregiver, but you're also observing the child's play and how they're interacting with you too. So it's really going to be dependent. So we provide also with our adapted MSR interview guide, for filing Child SSI claims, we do again address these types of questions and interviewing situations that you might be in that vary a little bit. So thanks for that, Laura, sharing your experience. We have a question too here. If children and their families are housed through permanent supportive housing programs, are they eligible for a SOAR application? Our program serves people who were chronically homeless, and it sounds like they're in a permanent supportive housing situation as well. Kristen, would you like to take that one?
Sure. Thanks, Pam. Great question. And absolutely. So SOAR is intended for individuals who are experiencing or at risk of homelessness. And if someone is in a permanent supportive housing program and has no income, they're definitely at risk of homelessness if they were to lose that housing voucher. And so we want to, help people obtain the kind of stable income they need to keep their housing stable and reduce that risk.
Thank you. And there was another question along those same lines. Does a child have to be literally homeless in order to be SOAR eligible? So I think that goes along the lines of that as well. It's homeless or at risk of homelessness, and we do provide a handout related to the definition of homelessness as well on the website in the online course. So I would, direct you to that as well. Because that's not going to be different really for children. Directed to that. We have a question about if a child is in foster care, are they eligible to apply for SSI? And I guess I'll direct that, to Laura and anyone else who would like to take that. If you are youth residing in a foster home, are you eligible for SSI?
Great. Well, I don't think typically. Because they're getting, and I'm going to mess it up, is it Title 4E? There's a certain kind of funding that they are probably being provided if they're adjudicated dependent. But that said, I have come across a couple cases where there are youth, and I mean a couple, and they seem to be getting SSI even though they are in foster care, and I'm not sure how that works. But in general, a large part of the DHS SOAR project that I mentioned, I am applying for kids that are in foster care and who are not eligible based on their resources, but we're applying like shortly before they're discharged, at which time they won't have the resources, and then they are eligible for SSI. So it's my understanding, and again, it's not my my area of expertise about the kind of funding that they provide for foster kids, but it's my understanding that that whatever they get through the Department of Human Services or wherever it's coming from would be their resource, and they could not also get SSI.
Kristen, did you want to also comment on that?
And maybe Kristen, somebody else might know differently.
I was just going to comment that that question is so much, and Laura, I don't think you're incorrect. I think it just depends, right? That there are certain cases where, depending on what type of funding a child is receiving, what type of institution or care they are in and under, that each circumstance is really unique. And so our best advice to SOAR providers and people out there is talk to your local SSA office about the specific scenario, and they can, help you figure out whether the child may be eligible based on their, unique circumstances.
That's really great. And we do address foster care placements in the online course too. So you'll find some information there as well, because we know we will be serving children who are in foster care, and it may depend on the state and, again, other ways that the child is being funded in that foster care situation. We do have another question, and this will be our last one, and it does highlight the need to enroll and take the online course, because you'll find the answer here. But it's along the lines of, how can we have children sign legal documents in regard to the SOAR process? And I might throw that out to Kristen to share her thoughts on that. I don't know, Kristen, if you heard that question about children signing legal documents in regard to the SOAR process. And it is one of those application types of questions.
Yes, got you. Okay. So, yeah, so it depends on the, circumstances of the child. So whether or not the child is an unaccompanied youth, if it is a, pregnant child or youth, whether or not they, sign their own documents on their own behalf, or if it is, a child living with a parent or caregiver who would sign for them. And so we definitely, like Pam has mentioned, the SOAR Online course has a lot of great information that kind of details out those specifics about who signs the forms. And there are even more like state-specific details about, whether a child at a certain age, signs their own authorization form for medical records, all of that. So there are lots of exceptions in the child world in terms of who signs what.
Great. Thanks, Kristen. Yes, and the course does talk about this issue as well, because we know in many of the circumstances it will be the parent or caregiver signing for the child, but in some cases it could be the youth signing the forms too. So I encourage you to take a look at the online course for that information. And we are running out of time, so if we didn't get to your question, we will definitely get those answered offline for you too. Some are pretty specific, and in some cases we can direct you to some additional resources. And maybe we'll need to get some more information from you. So I just want to take this moment to thank all of our presenters today for sharing your early experiences with embarking on growing SOAR in your states and communities. And thank you again. So I would just like to thank everyone for taking the time to learn about SOAR for Children, and encourage you to take the next step with enrolling, taking a look at the course. So keep your eyes out for our next webinar, which will be on the topic of getting started with completing SOAR-assisted applications, to be held on a date in April. So look for some registration details coming soon. So I just want to thank everyone, and have a great rest of your day. Thanks again for joining us. Bye-bye.